Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
COVID is still with us. It's a virus that's very survivable. It mutates. And so it's going to be around a long time, just like the flu is.
It's been 3 years since the pandemic hit, stopping us in our tracks. It flipped daily life upside down, claimed millions of lives, and changed the way we think about health. So where are we now? What have we learned, and what comes next? I sat down with Regence Executive Medical Director Dr. James Polo for some perspective.
We now have come to the realization that COVID is with us for good. Vaccination and boosters are going to continue to be part of our future, and we're probably going to continue to struggle with some of the emotional impacts of what the pandemic caused.
So let's start there, the lasting impacts on our mental health.
Typically, whenever you have a significant type disaster event, the behavioral health response that comes afterwards is longer lasting.
It changed our relationships, the way we work, how our kids were able to go to school, and for many, that came with anxiety, worry, stress, and depression.
But it takes a while to kind of recover from that long period of chronic stress and anxiety.
Dr. Polo says there are 3 takeaways when it comes to the pandemic and mental health. First, stress is normal. Emotional responses to stress are normal, and it's okay to not be okay. Mental health and physical health go hand in hand. A good baseline is eating well, exercise, and getting enough sleep. All that helps strengthen our mental health. And finally, if you think you need help, reach out and get it. Dr. Polo says start by talking to a trusted friend or family member.
But if you're having struggles that really seem beyond what you can handle, then reaching out to a professional.
And then there are the long-term impacts from the virus itself. Some people are still dealing with what's called long COVID or post-COVID conditions. COVID fog is one of the most commonly reported, fatigue that interferes with daily life. Other symptoms can be neurological, respiratory, heart-related, digestive, and even include muscle and joint pain. Moving forward, there are lessons learned during the pandemic, the need for work-life balance, virtual and expanded healthcare options, and the importance of good hygiene.
And I would hope also that people have learned that it's actually safe to get vaccinated, and that they do. Getting vaccinated is not only a good thing for them individually, but it helps protect the people around them.
For more stories to help you take charge of your health, visit kgw.com/healthiertogether.